Hi, my name is Alicia Levitt. Here's my student nursing ID. I have my full con uniform on. Alright, so the first thing I will do is limit any interruptions. I will close the door to the medication room. I would avoid any electronics or cell phones. I would also limit the conversation with my colleagues to extensive information only. I will also check the agency's check the agency's no interruption policy as well. No interruption zone policy. All right, so I have my order form and I have my MAR, and I'm just going to compare the two here. We have Jaguar J. Jones. We have the MR number 4176352, 4176352. The patient has an allergy of penicillin. We're giving the patient Novolin R regular insulin, 10 units subcutaneously, 30 minutes before meals, 10 units subcutaneously, 30 minutes before meals. So all elements of legal prescription are present. I'm gonna go ahead and move my order sheet out of the way. All right, so for my first check of accuracy, I'm just going to go over my 7 rights. We have Jaguar J. Jones. We're giving the patient Novolin R regular insulin. I have the Novolin R regular insulin. We're giving the patient 10 units subcutaneously, 30 minutes before meals. I am going to be using my 1/2 milliliter 29 gauge 1/2 inch needle insulin syringe. All right. So I'm going to go ahead and clean the vial here. All right. And just to note that normally with this medication, it is a high-risk medication. It will have to be verified by another nurse. All right, so I'm just going to take my syringe. With my syringe, I'm going to draw up 10 units of air. All right, so I have my 10 units of air. I'm going to remove my cap. I'm going to insert 10 units of air. I am going to withdraw 10 units of insulin, making sure I do not have any air bubbles, which I don't. All right, so I'm just gonna cap the medication. And I have 10 units of insulin. All right. Right indication here. We're going to give it 30 minutes before a meal. The patient has not had the medication. So all elements of legal prescription are present. So now I'm going to start with my second check here. All right. Make sure I have the right patient, Jaguar J. Jones. We are giving the patient Novolin R regular insulin. I have my Novolin R regular insulin. We're giving the patient 10 units. I have my 10 units here. We're giving the route subcutaneously. The right indication, 30 minutes before a meal. The right documentation here. All right, so all elements of legal prescription are present. So now I'm just going to take a piece of tape. And I'm going to label it. I am going to put my patient's name, the medication, and the dosage. So just to compare to my MAR, we have Jaguar J. Jones. We have Novolin regular insulin. We're giving the patient 10 units. I'm going to check. We have the Novolin regular insulin. And I'm going to check for 10 units, which is in my syringe. All right. So I'm going to go ahead and get my label here. I am going to stick my label on my syringe. Okay. Alrighty, so I have my label on my syringe. Alright. So, I have all elements of legal prescription present, and we're gonna go see Mr. Jones. So I'm gonna move these other medications out the way so we can get a view here. Alright, so I'm gonna take my MAR sheet, I'm gonna take my medication, and I'm going to take my syringe to Mr. Jones' room. Alright, so knock knock. Hi, Mr. Jones. My name is Alicia. I'm going to be administering your insulin today. I just want to do another check of verification here. All right, so we have Jaguar J. Jones, Jaguar J. Jones. We have date of birth of 8/25/1963, 8/25/1963. The MR number is 4176352. I have 4176352. I see you have a allergy ban of penicillin. I also see an allergy of penicillin on my chart as well. All right, do you have any other allergies that you would like to discuss today that you know of? All right, so you have no other known allergies. All right, so before I administer your medicine, Mr. Jones, I just wanted to do an assessment. I'm just gonna take a look at your pain assessment here. I'm going to take a look at your respiratory rate and your pulse, okay? Alrighty, so everything looks fine. Alright. Alright. So I'm just going to check again now that I have everything here. I'm going to go over my 7 rights. We have Jaguar J. Jones. We have Novolin R regular insulin. Novolin R regular insulin, Novolin R regular insulin here. We're going to give 10 units. I have 10 units in my syringe. We're going to give this subcutaneously 30 minutes before meal. So the right indication, you had not had this medication within 30 minutes. All right, so we're all set to go. So I'm just going to perform hand hygiene. I'm going to put on my gloves. I'm also going to put on my goggles. All right, Mr. Jones. All right, so with your injection, I'm going to give it subcutaneously. That means it's going to be in the abdominal area. I'm going to make sure I stay 2 inches away from the umbilicus. If I'm able to pinch 2 inches of skin, I will insert at a 90-degree angle. If I'm able to pinch 1 inch of skin, I'll insert at a 45-degree angle. So I just want to make sure that's okay with you. So I'm going to go ahead and clean my injection site, and I'm going to assess for any lesions or bruises. I don't see any. All right, Mr. Jones, so we're gonna go ahead and insert at a 90-degree angle today. So I'm just gonna remove my cap here and put it in my sharps container. I'm gonna go ahead and pinch the skin, and I'm going to inject at a 90-degree angle. All right, I'm going to aspirate to see if I see any blood, and I do not. So I'm going to slowly inject the insulin medication. All right, there you go. I'm going to apply a little pressure there. All right, Mr. Jones. Okay, so I'm just going to go ahead and just observe to see if you have any allergic reactions and make sure you're feeling fine before I leave out. I'm also going to document on my MAR chart here the medication that I administered today, and also if you have any allergic reactions to these medications. I will be back to check on you as well within 15 minutes. And do you have any questions for me? No? Okay, so I'm just gonna discard of my gloves here. Do hand hygiene. And that concludes my medication checkoff.